Welcome to Pacer Nursing Power Hour, your go-to spot for real talk and real tips in the world of nursing.
So scrub in, plug up, and let's go. This is Pacer Nursing Power Hour, where nursing students come to get powered up. I lost. That was completely out of my brain because I couldn't find it.
Oh, you
It is.
that's good. That's good.
I know. I
Good
remembered
job,
it. I remembered it.
For some reason, we can't
Yay!
memorize it.
Yeah, we're on a struggle bus this morning,
Yeah.
Curtis.
Sit on the wall. It'll make it a little.
Oh yeah, Curtis, you're hired. Production manager, right
Oh my
here,
God, that is
right here.
that
Why
is-
haven't we done that?
that is
That's
a
when you
perfect
know you have your head in
idea.
the sand.
Dude, that's why we need dudes with us.
Yeah.
Okay.
Which is the hot topic of the day.
Yeah. Oh, God. Good segue.
Yeah. Mhm.
Nice.
So today we're tackling a really important and inspiring topic, breaking stereotypes and the growing role of men in nursing.
Yeah, absolutely. Nursing has really historically been that profession where it's predominantly females. But, however, more and more and more men are actually entering the field. I think the first time I had a clinical group, just a clinical group, and I had more men than I did ladies. I was like, yeah, I
That's
like
awesome.
it.
I haven't had one of
So
those.
you're bringing your skill set. I mean, let's be fair. There is a little bit of a skill set, not a little bit, but there is that men bring to the table versus women. And so we are going to shatter those typical stereotypes, right? You
Yeah.
ready to do it?
Sounds good.
So we are excited. Curtis is
Yeah.
here with us. He is
You go, stealing my
also
lines
very
again.
close to leaving us.
So we are excited to welcome our special guest, Curtis Miskelly. Curtis is a nerdy nursing student
A
who,
ner-
not a
She
nerdy,
said nerdy.
That's
She
me.
did. I got it. I got it.
So Curtis is a nursing student who's not only excelling in the program, but also using his experience to inspire other nurses and, of course, other men to consider this path. So welcome, Curtis. We're excited to have you.
Yay! Yay! Yay!
Thank you for having me.
Yay!
Yeah.
First of all,
Yeah. So tell me your story.
That-
I know a little bit of your story, and I think it's fascinating.
I
had
don't.
Curtis in
However,
my clinical.
I don't. I didn't.
Yeah. So
I
tell us
had
your
him in
story,
summer,
Curtis.
but I
What
didn't get
got
to
you
know you.
here?
So this has been a few years ago, but I was actually a combat medic for 4th Infantry Division in the United States Army.
Thank you for your
Um,
service.
Thank you.
Thank you.
Golly.
But I've always had a passion about being in healthcare.
Wait, back up. It just sinks. That's my squirrel moments. That just sunk in.
Yeah.
You're a combat medic.
Yeah.
Yes, ma'am.
Don't
Isn't
call
that
me ma'am,
fascinating?
but thank you. So were you in combat?
No, I actually got injured while I was at NTC training for a mission going to Iraq, and I
So
wanted-
you were headed to Iraq.
Yes, ma'am. Sorry, it's habit.
I know, it's fine. In 6 months, I'm going to tell you, don't even call me you're calling me Mary. It's hard to break, I know. Okay, wow. So you
Uh-huh.
were headed there. Now
Yeah,
tell me, you have family in town? You have family?
my son and my mother, and I've got some relatives and my uncles.
How old
here,
is your
so
son?
He's 8 years old.
I did
And
not
it's
know.
his twin.
I didn't, like a mini him?
Yes.
Like
it is a miniature Curtis.
Sonny and you and Claire
I'm
and
not
me?
quite. People still say Sonny looks like Daniel.
No,
but
well, no, she's got
this
your attitude. She's
is
got your
a-
attitude.
Copy paste.
I did not know that.
Mhm.
Did not know. I hate it when I'm not in a class with you guys so much.
I know.
It's very upsetting.
So what inspired you to go into nursing? You said you've always been drawn to it. What was that? Do you know?
So whenever I got out of the military initially, I actually was accepted into a nursing program, but I ultimately took a job at a tire manufacturing facility for a few years. I did that for about 13 and a half years, and I always regretted not following through. And it got to a point where I was like, now's the time. There's
Sure.
no better time than the present. So I left that career and I enrolled here at USC Aiken.
So, if you don't mind me asking, how old are you, Curtis?
I am 41.
Shh.
I'm the baby in the room.
I would have never put you at 41, like max 30, max 30. So you're a non-traditional student. Well, you were navigating towards healthcare when you were in the Army, correct?
Yes, ma'am.
Right division, right branch. I mistakenly identified the wrong branch. All right, so you were headed towards that medic pathway. What made you lean towards that at that moment in
Um,
your life? Because you were young, right,
yeah,
when
I
you did
was
that?
23, I believe, whenever I got out of the military.
You entered the military at 18?
I was 19, close to
Okay.
20 whenever I actually was enrolled at Augusta State at the time for about a year, and then
For
I was actually a biology major.
gonna do what?
Um,
Let me guess.
Pre-med,
There
possibly.
you
I'm not
go.
Yeah,
sure.
I knew
Yep.
that was coming. I knew that was coming. All right. So so you were already kind of navigating towards that
Yeah,
field.
I've always been in healthcare since I was a kid. I've always been drawn to it,
Do you have
and
family in healthcare?
I do not. So that's
You're like me, first person in my family. Now I have a cousin who followed suit, and now I'm about to have a soon cousin-in-law. I don't the second cousin twice from. I don't understand any of that, but yeah, my one of my anyway. So yeah, so you're like me, first in healthcare. So do you get a lot of phone calls a lot going, hey, I got this weird
Yeah, I was
rash.
about to say, "Can you look at this rash for me? Send me a picture."
definitely during my time in the military.
Oh, yeah.
Goodness, like people
Sure you
knocking
saw
on my
all kinds
door,
of stuff.
yeah, people knocking on my door at 3 a.m. Yeah, it was wild.
Okay, so remind me, I know this is not here, and maybe down
Uh-huh.
in the script, but let's talk about his different scope and practice
Yeah,
in Army medic versus what
sure.
you're now learning that you're going to do as a nurse. So we're going to revisit that. So, so you went into the military, came out, went to a complete 180 tire manufacturer, which I'm relatively certain you probably made a little more money. Not gonna lie.
Yeah, I mean,
I
it was a
mean,
very lucrative career. I'm not gonna
yeah.
lie about that. I
Was
mean,
it that 7 on, 7 off kind of shift work?
um for my first 10.5 years, I was on days. My last several years, so
Wow, that's gotta be rough, 7 in a row. Okay. Alright, so, then you decided, "Hey, I wanna finish school." What made you choose Aiken USCA?
the reputation that USC Aiken has around here.
Yeah.
So that's why I chose to come here versus some of the other.
Now you're from Aiken?
I'm actually from Augusta.
Well, Curtis, I am curious, have you, throughout your career, come across any resistance to, being a male in this field? And even way back as being, a medic in the military, have you personally noticed any stereotyping or resistance?
Um, I'll start off with my military experience. I
Okay.
think I was my first couple years in the military. I was attached as a field medic.
Mhm.
I didn't really feel like I had any stereotypes then, due to the fact that I was around majority of guys.
Mhm.
But my last year in the military, I was actually detached from my unit and worked at at a health clinic, which at
Overseas or here in
it
the
was a
States?
station in Fort Hood. So
Fort Hood. Ooh, I just heard really bad documentary about Fort Hood. Or yeah, sorry. Okay,
so
sidetrack.
so my last year I was attached to a clinic which served soldiers and their families as well.
Oh, cool.
So it definitely gave me a different experience.
A little bit
Also,
different vibe.
oh for sure.
So you found for there, females were the minority in the medic area,
Yes, especially for where I was stationed at, which Fort Hood is a predominantly infantry base.
right?
So it's probably 95% men at that time.
Yeah.
I know
Gotcha.
things are changing now, but
All right. So now moving into nursing, how do you feel?
I've I feel like people have started to become a little bit more receptive to male nurses. I had experience whenever I was doing an externship at doctors. I had a couple patients that weren't comfortable
Hmm.
with me. It's generally the older female clients or patients.
Hmm. Hmm.
They're just not used to it. I mean,
They grew up in a completely a different generation.
but I also had some positive experiences. I had a older female patient, her and her family, they loved having me. I mean, they, um, sent compliments to my, nursing
Yes.
manager.
Oh, well, I can't imagine any patient not loving you
Mhm.
because even though I did not have you in clinical, I certainly can attest to just your personality, what I hear, what I've seen in class. There's no way.
Mhm.
I'm sure you're just amazing.
Thank you.
So when you started in level 4, how many males were in your class in level 4? Do you remember?
I wanna say it was about 6 or 7,
Okay.
somewhere around there.
Okay.
Sounds about right.
No.
And now you're in level 8. How many are there?
Since I joined level 8,
Now
Yeah,
there's
think
a
because you
lot.
we're
kind of merged in with
Yeah,
taking
yeah.
yeah,
summer
he fast
classes,
tracked
so
in. He's one of those uber
smart
smarts.
people,
Yes,
yep,
yes, yes.
because he has 12 computer screens.
Does he?
I'm telling you, every picture, another one bursts itself, and there's more on social media. I love it.
Okay, I'm not friends with you on Facebook or social. Right? Okay, I need to see more of
Well, the
this.
first time I saw it, it was at Starbucks. I ran in to get a coffee, and I turned around, and he's sitting at a table at Starbucks, and I think you had 2 or 3 computers there,
Do you
screens,
Yeah.
travel
like
with them?
pads and, like, all
No,
that
I
fun
just
stuff.
had my, like,
That was his
MacBook and,
travel
like,
system.
iPad, which I take
That was his
classes
mobile
again.
unit right there, ready for action, anything. I love it.
So how many are in level 8 right now?
Think we have 6.
Okay,
Yeah,
so
so that
not
yeah,
too
so
bad.
6 out of what, 24?
I think we're at, like,
Oh,
I think we're closer to 30.
you're
Yeah.
yeah,
That's
because
good.
you
Yeah.
guys matriculated up. Yeah,
Yeah.
yeah.
Cool.
So that's awesome.
Yeah.
And so I know, females. Well, how did you feel when you did peds? Because I always that was my biggest not fear, but a little bit of anxiety. I tried very hard not to pair, like a teenage girl with a male nursing student, and maybe that's bad of me or not, but I mean, it was for the kids.
I mean, Paige was interesting. I think for me, having a child already
Yeah,
makes a big
that's true.
difference,
Huge
versus
difference.
a traditional 20 or 21-year-old,
Mhm.
male nurse
I
some
agree.
students, you know, I've been in the hospital at 3 a.m. with my child, so it's
You had a lot of
definitely
empathy and
Yeah.
you knew firsthand that experience. All right. Well,
Yeah.
that's awesome. How did you like peds?
it was it was a good experience. I mean, at the end of the day, it's sad to see kids that are really sick.
Mm.
Um, I definitely will have to say that's not the field of nursing for me.
Same.
But
Cried every day.
yeah, I just
You did not.
Yes, I did. You can ask Daniel. Every day I drove
How
back from Augusta crying.
you after she was I always have to say this. She was in one of my groups.
Mhm.
You left
Every week,
you
yeah.
left
He was like,
clinical.
"Katie,
Did I
you're
do
not
something
allowed to
wrong?
go." Kennedy. She does this all the time. She thinks it's her fault. No, sick kids.
I
That's what
hate
makes me
it.
sad.
I hate it when my students cry.
Okay, so tell me about some of your favorite clinical experiences and whether you think being male played into those or not.
Oh, he
to be
wrote it.
I
yeah.
know he's prepared.
He answered the question.
This is Curtis in a
Dude,
nutshell.
I mean,
Love it. He's gonna
you're
do big things. We're
amazing.
gonna see him like on the
Amazing.
cover of Time one day for
You're
curing something. I don't
yeah,
know.
yeah,
Yeah.
yeah, yeah, absolutely.
Believe it or not, it was probably my rotation with you. Um, so
Okay, well, let's talk about that because I hate maternity, and she
So
knows that.
yes,
So
women's health.
tell him the word.
Just for everyone who doesn't know, I'm in women's health,
Yes,
and I was waiting to brag on Curtis. I've never gotten as big as kudos from Dr. Minto as I did.
no way,
Curtis.
Minto.
Yes.
Mint.
She never gives compliments.
She scared me.
Yes.
Wow,
Yes.
that's amazing.
People are scared because
So-
she has such high standards.
Oh,
you
she
know?
does. But
I definitely want her taking care of me for sure.
I can't. In fact, there's a word I will not say ever, 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 because that's my thing. So, did you see a delivery? Did you participate
yes.
in
yeah,
delivery?
Oh, yes.
Vaginal. Oh, I
Oh.
said it. I said it.
Proud of you.
I said it.
I'm
I
proud of
hate
you.
that
so I
word.
participated in several vaginals and a cesarean as well. It was a good experience. I was a little nervous when we first started. I just really didn't know what to expect. Um, being a male,
Yeah,
delivering babies, I'm
what
just
was
Mhm.
your first like, when you got your first patient, what was, like, her reception towards you?
I feel like every patient I dealt with was, very positive. Every experience was positive. They just,
And you were not at an academic medical facility, or were
Mm-mm.
you?
We were here.
yeah.
Okay, so that's cool.
What advice would you give a male student coming into, like, a women's health scenario?
I mean, first off is being receptive.
Yeah,
Lean on your peers,
sure.
lean on your instructors, lean on your mentors.
Yeah.
You know,
Who is your
don't
what kind of mentor do you look for, or do you have
I
currently?
currently don't have a mentor. I do
Okay,
have some really amazing classmates that I feel like we're all there for each other. We
and we talk about
communicate.
that too. The bond in your class is something that is just
Yeah, y'all have a really good group.
uh,
yeah, y'all are a really good group.
Mhm.
All right, so some common stereotypes that we see for men in nursing. Um, Men aren't as compassionate or nurturing. What would you say about that?
um, I'm not gonna lie. That's kind of one of the things I questioned myself whenever I first started. Am I compassionate enough? Am I nurturing enough? I feel like if you come into it with an open mind, you obviously enrolled in nursing because there was some part of you that is compassionate and nurturing. Um, I just think you've got to
Oh,
come into it
well,
with a
at what
positive
point
mind
did you
point.
say, "Okay, I got it. I got this"? When was that?
I think I'm still trying to figure that out right now.
Oh,
But,
no! No.
no,
Curtis, you're gonna do big
yeah,
things. We all know it.
um, probably I think between level 4 and then my time as a nurse extern. I don't know.
What was your part?
I realized that I enjoyed helping people. You know, it it was fulfilling for myself, and that was one of the reasons also why I decided to come back to school and leave it.
Yeah. So when you were doing a nurse extern, what kind of unit were you on?
I was float pool.
Oh, wow.
Oh,
So you got to see
wow.
all the
Yeah,
things.
so
Yeah.
which I enjoyed. I spent some time in the ICU, the ED, renal floor, med surg.
So that brings me to, because the first time I see a dude, and I'm sorry, it's probably inappropriate when you saying dude. Male nurses are suited for physical tasks.
Mhm.
How often did you
Oh my
get,
gosh.
hey, can you come help me lift or transfer or whatever?
I feel like even during clinical rotations, I'm like that.
Yes. I
I'm
know.
getting pulled every
Yes.
way, even when they're not even our patients. They'll be like, "Hey, can you come help us?" I mean,
Like,
which
even the
I
nursing staff will grab
That
him.
yeah.
irritates me though, because you're not there to be their tech. You're there to learn. I will say the only time that I will let a dude do the dude stuff is CPR. I am not
Ooh, I
about
love me some
CPR.
CPR.
It hurts I'm not all about exercise. Okay.
So, we've kinda touched on patients may or may not feel uncomfortable with the male nurse. How have you handled those first interactions with patients to help overcome that hurdle? Do you lean on your clinical instructor, or are there things that you do personally that help you put yourself at ease and the patient at ease?
Feel like I do a little bit of both. I know there are certain situations where no matter what I do, or can be as compassionate as possible. Um, some patients are going to be in that mindset. Well, females should be their
Mhm.
nurse versus a male nurse, and it's
Do you get
generally
called doctor a lot when you walk in the room? I mean, not now, I think probably because you're in red
Red
scrubs,
scrubs.
but I guarantee you when you start working,
Oh, yeah.
they're gonna call you doctor.
um no, I haven't had that experience yet.
It's
I
coming.
just think
It's
It's
coming.
coming. It's
It's
just
coming.
like, all females that walk into a patient's room are nurses. You know what I mean?
Mhm.
Okay, sorry.
I think they're generally shocked that they're like you're 41-year-old nursing student.
Okay, well, again, I
Thank you.
don't believe that
Thank
you're
you.
41. I'm gonna need to see ID. I don't believe that at all, at all.
What has your most uncomfortable experience been?
I don't think I've really had an uncomfortable experience, to be honest with you. I'm always receptive to learning. So I don't have that mindset that a situation is
Mhm.
uncomfortable to me. So
And I think that goes along with your age and the fact that this is, you're a non-traditional student and you have life experience
yeah,
behind you. So I feel like that is a completely different perspective. And, come to think of it, thinking of your classmates that are males, are they non-traditional as well?
I want to say at least half of us are,
That's interesting.
especially in
I've
my
never
in my new
thought about
cohort
that.
now.
Mhm. I mean, I'm thinking about the many, many male students that I've had in the past, and I cannot really name more than 5 that were not
That makes
non-traditional.
sense, yeah. So,
Any funny moments in your, school so far? Like, clinical school class, studying? Like, have you ever had a blonde moment during nursing school?
I think I have a blonde moment every
Oh,
day. I
you
mean,
do
like,
not. You do not. I don't
I don't
buy
know.
that.
I haven't obviously had a lot of classes with D, but I mean, I generally like to keep the mood light. I mean, I will.
You do. It is always,
mhm,
you always have a smile on your face, and
mhm,
that's so, it's so, reassuring as a faculty.
yeah.
Because a lot of times you just get, like, and then, the dead face that, when you've
That's
completely
hard
lost
standing in
them,
front of 40 people and they're all just like,
like, in the middle of the cardiac lecture.
yeah.
Like, even at that point, I think I looked over at you and you were still like,
"Oh, yeah, that's
"Cool,
cool."
yeah." Like, "Yay. Yay, yay, yay.
I remember my question.
Yay."
You talked about just kinda being open and having those life experiences that prevent you from feeling uncomfortable. Do you think that opens you up to learning easier, like, retaining information
I definitely think
easier?
it's helpful. You don't have that negative like connotation or
Mhm.
negative like I guess or something negative hindering you.
Yeah.
You know, but for myself, like I love to learn new things,
Mhm.
so I'm always receptive to you know advice or any piece of information that, especially if it can be helpful, in the future.
Yeah.
Yeah,
Um,
I have found going back to school later in life, you definitely appreciate that education a
Mm.
lot more. Like I'm never a study nerd, but I nerd out, don't I?
You do. You get
With my
excited.
with my school right now.
I, see, I know. So I have a bachelor's and associates already, but I did it.
And what?
So my bachelor's is actually in business management, and my associate's is in computer electronics engineering.
So you're about to
So he
have
was laughing at us trying to get Roku set up. He was like, "Can you
Yeah,
just"
I
he
should
was
have
just
said
like, "Professor
you.
Kennedy, can you just give me the remote, please? Just
I know, like,
stop. Just
he
give
was
me the remote."
probably internally, like, dying a
Dying.
little bit because that's what I do. I do all the time. Alright, dude, next time, just go, "Kennedy, give it to me, Kennedy." Um, so you have 2, this will be your 3rd. Now let me ask you, what made you did you first of all, when you were going back to school, when you decided after you worked at the tire place, did you research any CNL programs prior to looking at USC-ACAM?
I can answer that for him.
Nah,
I know that was a
yeah,
no.
no,
Why?
didn't really think about it.
Okay, didn't know it was there, didn't
Yeah, didn't
know,
really know a lot about it.
and I think the name CNL is a brings a different connotation to what it really is.
Right, but you already have a bachelor's. I mean, I came into this program with a bachelor's degree already. You don't do all your gen eds. You just skip to
Right,
the meat of the stuff.
Uh,
So there's
yeah.
no sense in like wasting what 18 months or whatever. Like, whatever time there is
Well, see, now
when
no,
you
you just need
can
to undergrad and and that's what you do. You get
yeah,
your
you just go straight
nursing
to the
and you
BSN
get an
program.
MSN
yeah.
instead of another
Yeah, I mean, there are
baccalaureate.
programs
Yeah, I
where in
know there are
18 months you can
several
get
other
both.
classmates that already have a bachelor's degree, and we have kind of discussed that before. Like, why didn't we go into the master's of nursing program? I know I worked with a guy at Doctors, and that's the program that he did because he was a counselor at first. So I
Interesting.
don't I don't know, but then again, I wouldn't be here, and I really enjoyed my time here at USC Aiken between students, especially the instructors. I don't know, my experience at USC Aiken has been extremely positive.
That's
Oh,
good.
I love
So,
that.
Well,
Will you come to do recruitment stuff with me?
yeah.
Mm,
And I will
absolutely.
say, like, I mean, life stuff, I was never in the military or anything like that, but degree-wise, we are very similar, and looking back, I'm glad I did this route. Um, so I think you'll look back and be
I
happy
mean,
with your choices.
yeah, I mean, I feel that way now.
Yeah.
Like, I mean, knowing even what I know now, I'm like, I wouldn't trade it for the experiences that I've had here at USC Aiken so far. So,
Okay, I'm just gonna forewarn you, when they find out that you have a bachelor's in what, business?
yes, ma'am.
And business, you are going to be thrust up into some management roles very fast.
I have management experience
And
before, and I'm just like,
I honestly, I would say hone your skills and then go for it, bud. Do it, do it, do it, do it. All right.
Mhm.
What about what any like professors or anybody, anything stands out at you that along your journey in any degree that you have, you're about to have three, you know?
um, I would say it'd be um the most positive memories, I guess, or I guess the best relationships I've had with are my instructors
Being
here.
having access to
Yes.
them.
That's one of my favorite things about USC Aiken is um, all the professors that I've dealt with at USC Aiken, even prior to joining the nursing program, have been very helpful. At
So,
the end of the day, they want their students to succeed, and
I can
that's
say that for
extremely
sure.
important.
absolutely.
Yep.
Did you have to do any gen eds when you got here?
I had to take my sciences when I got here,
Okay.
so
Yeah, I mean, I can see that. I can see that. All right.
So I want to get into the meat of this podcast. How do you think men in nursing strengthens this profession for all of us?
Not physically, not physical strength.
Yeah.
it definitely helps us that we can help turn patients.
Yeah, I mean, not
All
gonna
right.
lie,
You don't
y'all.
have to break a sweat. Thanks.
It was pretty useful during COVID when those MICU patients needed to be proned.
Mhm.
I mean, this So I think having men in nursing strengthens the profession. It adds balance and diversity.
Yeah,
Patients are coming from all backgrounds, all ethnicities, and it's just we have such an influx of population, especially in the
right.
United States.
Oh, yeah.
Mhm.
So I think it helps. I think it helps the staff. Having a little bit of diversity, and I think it also helps with the patient care.
Absolutely.
So.
I completely agree. I think all of us as individuals, whether you're male, female, whatever, are going to bring something different to the table. And I know even just working in different units, whether it's the ER or L&D with my
Mhm.
experience, you know, some nurses are really great with patients that don't have an epidural and some nurses just aren't. It doesn't matter who they are. They connect well with different patients, whether depending on the situation. And same thing in the ER. Some people don't have patience for certain types of patients.
Mhm.
And
We know
all
that.
of us as
I mean, as
individuals bring something to the table to bring the best patient care to those people.
in my perspective, I want to tell you one of the first times it kind of dawned on me that, oh God, this is kind of cool. And it was something so small, but so significant that I still can see this to this day. I was working with a male nurse. And just the way that he approached things, and so we were at that joint, y'all probably don't remember, where we were shifting from pounds to kilograms, like it had to be just kinda how we're doing. I'm refused to do Celsius, I still can't figure that out. But he was like, "I know an easy way to figure out your kilos without getting out your calculator." I'm like, "What do you mean?" He goes, "Just divide by 2 and subtract 10%." Like, his mind was so
Why have I
analytically.
never thought about that?
I know, and so I was like, "Holy crap, you were absolutely right." So, like, just that perspective, be smart, do it smarter, not harder. Like, I carry so to me, when I think about males, I immediately go to him. And, just, like, the different ways, because my husband would have already just like trying to
Fix the
take over
TV.
fix the TV for me. I mean, my husband knows certainly that, "Okay, I'm doing this, Mary, not you," you
Yeah.
know? So I'm like,
Yeah.
"All right." But it's not because I can't do it. He just won't let me.
Well, I'm really curious to ask you this next question. Do you think gender diversity plays a role in team dynamics, and how?
Um, I do. I think it improves the patient care and team dynamics.
Mhm.
When you have a mixed voices on the floor, you get different ways of thinking, problem solving, communicating.
Yeah.
It helps create balanced care, strengthens how the team works together.
So in SimLab, do
So,
you find yourself, because that's a team, you function as a team in SimLab. Do you find yourself your cohort, like whoever you're with, do they automatically put you in like the leader role?
Yes. Yes.
I definitely felt that the first couple of semesters, and like I have intentionally tried to
Step
start taking
back.
a step back.
That's how cool of a person Curtis is.
I know. That's
But
very
I even witnessed that in my class too. I mean, he recognizes that he has those leadership skills, which you're going to use throughout your entire
that's
career.
amazing.
Um, but he does it in a way where he lets everyone else shine. That's how good of a leader he is. So
I love that. You're a
I really am
transformational
excited to see
leader.
what you do. You're going to
That's,
do incredible things.
have you learned that yet in leadership, transformational leading?
Yes.
Okay.
Uh,
I teach you
yeah.
leadership all.
Yeah.
Very good. I love that. I love that. I love that. So, how do you think being a male, how do you feel like you can be that representation for male patients who may feel more comfortable with a male nurse?
I mean, obviously, one being a male, but I don't know. I think it just
Is there
uh,
any awkwardness to some aspects of care for males with you? No.
no
No.
for me. No, I mean, I dealt with a bunch of infantry guys for
Mm,
several years.
it's
I
like old
mean,
hat.
yeah, it's
Well, I have in women's health, there's women who will prefer a male OBGYN. They say, oh, they're more gentle, or oh, they're more understanding, or maybe they just have an experience and they're more empathetic because they think it's terrible, or whatever the situation is. They demand a male OBGYN. Have you found any situation where a male's like, nope, I want a female to touch me, or
I haven't had that experience.
okay.
I guess if I came across that, I mean, I would try to adapt to what the patient wants. But I mean, I feel like most of the male patients that I've dealt with have been very, I guess, understanding or willing, to have a male nurse or male student nurse.
Yeah.
So,
And I'm going to say, being a nurse for 30 something years, um, and back when I started, I think we had two males in my nursing class of like 70. And then I only worked with two when they were in the PACU. So I typically have found that male nurses gravitate towards those kind of specialized units, ICU, stuff like that. But receptions from patients have shifted so much because
Hmm.
of, I think there's more happening and patients are more accepting. Now, however, I still worry about the sleeves
Oh yeah.
and the piercings.
Hmm.
That's a little hard to digest.
But that's a totally different perspective for me, and I don't know about you, but that doesn't even phase me,
uh,
Doesn't phase me, and I think that may be just the
My
era. Yeah,
generation,
the
yeah.
era that
I'm Gen X, man.
get it, girl.
I'm
You
Gen
get
X. I was dropped off and said, "Clean up and fix your own dinner."
it.
I'm kidding, I wasn't, but still. I
Have
mean,
you have you seen in clinical or externships or whatnot, um, you as a male being treated differently, whether that's a pro or a con versus a female?
from what? From who? Like
Anyone.
a
Doctors,
nurse?
nursing staff, patients, anyone.
I feel like that's a double-sided question.
Okay.
One, I feel like everyone knows that I'm a little bit older than my other
Cohort.
students or
Sure.
cohort, so I haven't really experienced,
Okay.
I guess
Now,
the
has
bias
anyone
or any.
given you more respect over someone else because of your age? No?
I don't know. I
Okay.
take everything
And
lighthearted,
he's
Curtis is
so
just a good human.
he
That's
won't
what
just
we're
like
say
saying.
it.
I was
Curtis
just
is just
like,
a good human.
He won't say it
He's just
anyway. He
awesome.
won't.
All right.
You're too
I get it.
nice.
I get it, Curtis.
Yeah, okay.
I'm a team player. I mean, at
You
the end of the
are.
day, like
You are. You are.
I have whether it's my classmates or coworkers, like
You don't leave
I
anybody behind. And I feel like, this really kind of brings it home to
I feel like that's
so
an army motto right there.
yes,
Yeah. Well,
because
I mean, that plays a huge role.
huge, because when I was in Albany, and just a quick story, during COVID, I was deployed, or not deployed, but sent to Albany, and I was with the National Guard unit, and for some reason, I thought it was a good idea to go for a run with all of them. Did not
Oh gosh.
know
Oh gosh.
that they don't leave you behind. They will run ahead, but then circle back to keep like it's like
So
a
did they run 10 more miles than you?
yes, they do, because they're rotating, circling, keeping up, and making sure I'm not
Yeah.
left behind. I'm like,
Wow.
"Oh my god,
Okay.
I'm so sorry, but oh my god, this is cool." Like seeing them, and they were happy, like they were like, "Let's do it. Come on, let's do it, Kennedy. Get it. Go, 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 go."
Oh my gosh.
It
Yeah, I'd
was so
die.
I feel like that's part of that training that you had. That's kind
That's
of
cool.
inherent and already built in.
Yeah, no,
Curtis doesn't even know what to do with it.
um, I don't know. I just, definitely my experience is very helpful. I do feel like some of my classmates feed off of that as well. Um,
Well, I feel like your classmates when you're around us, you're set people, you model each other.
Mhm.
And I feel like that's where you garnered a lot of respect, because I see the students modeling after you.
Yeah, y'all.
And to be fair, the first however many lectures I had with him, I called him Charles, and he never
He
once,
never will say it.
never
No.
once, and it wasn't. I don't know where I was when I saw or heard Curtis. I was like, who?
Who's that?
And they're like, Miss Kelly. I'm like, oh, that little
See, that is
sweet.
a pro of working with Dr. Edwards. Their like intro discussion, she finds out all this information and then she relays it to me and I'm like, oh, okay. Yeah.
Well, I mean, I usually do that with my clinical group.
Yeah.
Like I get all up and nosy
Not the
with them,
big
but I
crib.
didn't
Yeah, I feel
have
you.
clinicals this semester, so
Well, you kind of mentioned this, but everything that I researched, men do tend to gravitate towards critical care areas like ICU, ER, which is where I think you're headed, right?
yeah.
that's definitely where I want to go.
I feel like that's absolutely appropriate.
Yeah,
Yeah, I mean, I just like the fast-paced environment.
sure.
I guess I like a little bit of insanity as well at the same
Yeah.
time.
And you will get it there,
Yeah.
and you may lose it there too, but I mean, you'll get it back eventually.
Yeah.
Now, across the board, why do you think that is for men?
I feel like men have the ability to detach themselves a little bit.
That is great.
That is a very good perspective.
I was just thinking it's just more manly, but you're so right.
So I just
They
think
can
that
come home and like flip the switch.
Yeah. we have the ability, especially in an ER setting. I just feel like we have the
Yes.
ability to detach, move on to the next patient or
I have
ICU.
never.
Why did that light bulb just go off? Curtis.
I swear to God, I love these interviews.
Yes, every
We
time we're like,
learned something
nuh-uh.
so amazing. That is
Yes.
absolutely right, because we try to say as faculty, you got to leave it at the hospital, and many times you don't.
It's hard. You're still texting, you're like nursing, like whoever you worked with, like, oh my gosh,
they
that was a
okay?
rough day.
I remember calling
and you're
Wilson,
so
and
right.
she relieved me one night when I was in NICU, and I was worried about a baby, and I remember calling her at like 12 o'clock at night. She's like, "Why are you awake? You've got to come back and relieve me. Go back."
Yeah. It's funny.
That's awesome.
That is great, man. Well, then that segues into what unique strengths men may bring to the field.
Yeah.
That's huge. My mind is like,
Do you find yourself like, and I know we push on critical thinking and thinking for yourself, but do you find yourself do you study in a group first of all?
I do a little bit of both.
Okay.
I
I feel
don't
like
know.
you're
I
probably
feel I feel like a level 8. Like I'm still trying to figure out my learning.
style.
but I think that's
Yeah,
a
it's
huge
just
lesson for
yeah.
students too. We talk about every semester you kind of have to pivot and adapt,
Yeah.
pivot and adapt, because there's no professor the same, there's no class the same, the content's different. And you have to constantly
Studying for
change
it's
your
different.
habits.
Yeah.
And that's throughout your nursing career.
Yeah, I mean, you're gonna have an appendectomy or a hot appy that walks in the door, and then the next time you're gonna have like a GSW to 15 different places, and then you're gonna have a neuro who fell down.
Mhm.
So it's constant pivot and
Yeah.
adapting. And each physician is very particular too.
So that's
Yeah,
a
I've
good.
definitely noticed that every physician is different.
Mhm.
I feel like men also have a different way of like problem solving.
Sure.
That's what I was trying to get to. Problem
Yeah.
solving, yes.
So you know, well, especially for myself, I'll speak for myself. Working as a medic in the army prior, and then going into manufacturing where I was doing operations and doing maintenance as well. I guess I just have a different way of looking at things.
Sure.
You
Which
MacGyver stuff. Do you know who MacGyver is too?
I
That's like a
No,
term.
it's
It's like even if you don't even know who it is, just MacGyvering something is like slang.
I find men typically do that. Well, Wilson's pretty good about that, and Gaffney, but still, I feel like men are really adaptable for that.
Yeah.
I do have a question though, because I did work with a nurse in the ER who had also been an army medic. So I don't. Can we hit this now?
I don't know what you're about to say.
So there's a huge difference in what you do as an army medic and what you can only do as a nurse.
Oh, definitely. That's
Because I would have to, go pull it back in. So what's the difference?
all right for an army medic, especially when you're attached to um like an infantry unit. I mean, you are the doc. The things that we were trained on, whether it's like someone had like a tension pneumothorax, we were taught how to relieve the pressure. I
That's
had
awesome.
I had IV bags in my bag at all times. It's not like I had to go check it out.
And you were a medic.
Yes, ma'am.
So yeah, all right. So now when you're in clinical, do you find yourself tipping to that edge? Like maybe wanting to cross that line? Because it sounds like you're doing a lot of diagnostic, a
Mhm.
lot of diagnosing,
Mhm.
a lot of like then doing,
Ordering.
ordering. Yeah. So do you, ha-
Well,
that's,
so I've had a gap, obviously. So like I've- I'm always very careful not trying to overstep as well,
Mhm.
but also allowing, I guess, fellow students to, see their views on things as well. I'm just trying to absorb all the information I can, and trying to be the best nurse I can
Yeah.
be.
yeah.
Well, I
So
think those skills will come in handy, and I think you're reasonable enough to be like, "Hey, doc, this is what's going on.
Yeah.
Do you mind if I do this?" And
You
I think
know,
having that gap definitely helps. I guess if I would have done nursing school right after getting
straight
out,
through,
it would
yeah,
have been hard.
a
yeah,
little
for
bit more
sure.
difficult.
So
That's
I'm
true.
curious, like when you graduate and work, we want you to come back because
Yeah,
we're still going to be sitting in
you're
here
gonna take
still trying to
clinicals.
figure out how to mirror the screen on the TV. Um, but I want you to come back and talk about like ha- moments where you know what's happening and the doctor's not getting there, but you
Mhm.
are already there. I want to know. I want to see how you're handling because you are going to be that person. You already
You
have an
are.
amazing amount of clinical reasoning just sitting here talking to you. So it's going to be struggle, especially if you go to an academic facility.
Oh gosh, yeah. I'd be
I,
like, "Oh my gosh, just get to the answer."
I'm like, dude, here, come on, scoot over. So I'm curious. I can't wait to see how that is. Where are you wanting to go work? I know you want to work in the ER, but
So I took a scholarship from the VA,
oh, I love
so
that.
I will be working for the VA for at least 2 to 2.5 years. I applied for a residency program in Charleston at the Ralph Johnson VA, right next to MUSC.
You're gonna move?
Yep, for at least a year.
Aw. Well,
Uh,
Charleston, I mean,
You're not too shabby.
rock on,
Not too
bro.
shabby.
I
Rock
mean,
on.
there's a lot of worse places I could
Yeah,
live.
there are. There's a
Have
lot
a
of
spare
worse
bedroom. I'm
places.
coming. I'm coming. Kennedy's coming.
So I will definitely be moving there for at least a year. And then, once that residency over, I'm not sure yet.
See what
So
happens.
yeah,
Sure.
Go to Quantico.
I'm getting too old for that.
I know. I just want someone to give me a sweatshirt from there.
That would be cool.
I know. I
Get
know.
to if you
I
go.
know.
How would you encourage or what advice would you give to men that are considering nursing or kind of just starting their journey?
I guess my advice to young men thinking about nursing school is simple: don't let stereotypes or outside options decide for you.
Love it.
If you feel called to it, go for it. Nursing is going to be challenging. Nursing school is challenging.
Mm-hmm.
Trust me. I think I'm getting gray hairs thinking about my next exam right now.
You have an
But
exam today?
no, I do not. Thank God.
Okay.
On
But
Monday.
but nursing's a career that has real purpose, and that's one of the biggest things why I enrolled here. As I get tired of punching the clock. I mean, that's essentially what I did for almost 13 years, and
Mhm.
and I was not this happy. I promise you, I looked miserable. Like
Aw.
I have met coworkers like within the last year that I've worked with, and they're like, "You just look so much happier." They're like, "You don't look miserable." I was like,
I imagine it's
You're
a
like
lot
that.
of repetitiveness for that. Because I was about to say, you're still going to clock in,
"Oh
clock
yeah."
out, but it's a different
It is.
experience in between.
What? And you're like that social media trend. You look so much. Point of view, you look so much happier now. Oh, I've been in nursing school. Said no one ever.
Oh my God, we need to do that because everyone's like, they're like pulling me out of the office.
Uh-huh.
We need to have one happy.
Yep.
I
Absolutely.
love it that you're happy being in school.
Do you have any
Mhm.
practical tips for men or just students in general that are in the throes of nursing school?
Some practical tips. I mean, be open-minded. I feel like that's number one. And also don't feel like you're gonna do it all by yourself. Like
That's great.
I came into that mindset like I'm not gonna make any friends. Like I'm here to focus. I'm here to graduate. And
And here you
yeah,
are. Y'all have a tight-knit group. I
Yeah.
love seeing you guys.
Is it the one your summer? Are those your
yes,
people?
yeah,
Mhm.
we are definitely very close.
Mhm.
I would not trade them for the world. That's
love it.
definitely made it.
I felt that.
It's made my experience here much better.
I have my nursing loves,
Mhm.
and that 30 something years later, we still get together. We all, graduated, got married, had babies, play our kids, and now they're, we're in our later. See,
I'll watch them get married and have
There-
babies. I'll get on that.
Curtis is
you're not
kidding.
going to do that. I have a daughter. I have one left.
Oh my gosh.
I say that to everyone,
Yeah, I was
don't I?
about to say.
Katie
oh
is so mad at me.
Oh gosh.
She came over last night. She wouldn't let me hug her, so I was
Oh, I saw.
chasing her around the yard going, "Give me a hug." She's like, "You
You're
have
so
COVID."
silly.
Okay, yeah, she's really a cool kid, though. She's
Well,
very wise beyond her years.
while you consider that, Curtis,
And you have me as a mother-in-law. I mean, come
I mean,
on.
talk about a double-edged sword.
My daughter is like going, "Oh God, Madre."
Well, we have made it to my favorite part of these episodes.
Oh yeah, this
We
is our
call it
favorite stuff.
Stethoscope hot takes.
Not
Okay.
dates. I have to say that
Yes,
every time.
Not dates. It's.
The first
I
time
can
she
see where
said
you
it.
would get confused, but it's stethoscope hot takes. So these are quick, rapid questions. Just say the first thing that comes to your mind. Initially, I had put down coffee or tea, but I know you don't always fall into that category. So what's your favorite source of caffeine?
It's gonna be energy drinks and coffee. I
Uh-huh.
mean, it's
I always see him with an energy
Yeah.
drink.
Do you put energy drink in the coffee?
Ooh.
I think
Now, there are coffee-flavored energy drinks.
so.
Y'all
I
are
think
gonna die from, like hypertension with
Mhm.
all this caffeine.
which is crazy is like I'm actually bradycardic. I have low heart rate. I
See,
mean, it's
So maybe you
this is
need
a
more.
treatment.
Yeah.
You need more.
exactly.
Drink more, buddy. Drink more.
What's your favorite flavor?
Ooh, I
What
don't think I have a
brand?
specific. I really like the Ghost energy drinks right now. If
I haven't
not,
had
I'll
those.
go get like a sweet vanilla cold brew from Starbucks.
Nice.
So
I cannot do
She's
this
not a girly coffee
cold
drinker.
coffee.
I
Coffee's hot, people.
well, I do start off my mornings with a hot coffee though.
Thank
Like
you.
I'm up at like 5:30 every day.
Oh
So
my God, you're another one of those.
Yep.
Well, I mean, you're military.
Okay.
I don't go to bed
Next.
till 1.
me
Next.
too.
Oh, Jesus
No
Lord.
pressure. No pressure with the
Okay,
next question.
yeah.
But what was your favorite clinical rotation?
I think I mentioned it earlier. Women's health.
That-
Which
I'm gonna be walking on cloud nine all day
Oh,
because of that. Just
crazy.
saying.
I mean,
Yep.
which was the one I feared the most. I mean, I was like, yeah, I'm
Is it
like,
because you saw a lot of action? You think?
obviously, well, my clinical instructor was amazing. It was
Sucker.
we got to see, we did get to see a lot of things, and like Dr. Mento, like, she looked
Mhm.
great.
Yeah.
Like, whatever, like, I wanted to be a part of, she let me do it.
I
Good.
like physicians like that
Yep.
that treat you with that amount of respect.
Yeah. If you could wear any scrub color, what would you
Mm.
wear?
Like, I'm kinda torn, like, blue's my favorite color,
Okay.
which
The light or the navy or the
uh,
teal?
probably the teal, or black. Black's slimming.
Black's always
Yeah.
classic.
Black is my
Yeah.
favorite. I wanted to go
Why
with
do you
black.
I feel like smarter or a little more
I'm
edgy.
ready.
That's a good word.
Come
I
at
feel
me.
more edgy in black.
Yeah.
Like, I roll into work and I'm wearing my black scrubs. I'm like, yeah, I got this today.
And
What is that about black?
I don't know, but when they switched I say costumes, scrub colors at the hospital the first time across the street, we voted. And I'm like, I swear to God, if all of you do not vote black, you are dead to me. And they didn't. We went with navy. And I'm like, oh, that is like, I refuse to wear, I'm wearing navy now, but it took years to not wear navy.
I mean, which is funny is, like, I gravitate towards bright colors, but, like, scrubs, like, yeah, I
It
think
makes
black.
sense. I mean, it covers everything.
Exactly.
Now, she was back in the day where she had white scrubs.
Yeah. I actually pulled that picture today.
Did you?
Mhm.
We need to put it on the wall.
Oh, we can. Yeah.
Yeah.
Along with our script. Yep.
Yeah.
Our intro.
We need to, I know exactly what we're going to do. I
Okay.
know.
She's
Get
got
one
it.
of those, like, LED boards.
There you go.
That it's just constantly
I
moving.
know exactly what we're going to do. Okay,
Oh, I
cool
can't wait.
beans. See, this is what we need him here for.
Yep. What is your best nursing school memory so far?
I can't even pinpoint, like, a specific moment. My overall experience has been great.
That's
It's just,
fabulous.
like, I've sat here and thought about what was, like, the one great moment, but I think I've kind of embraced the whole moment, the whole experience.
That's great. I love that.
It's the journey.
It
Yeah.
is.
It is
Exactly.
that's for you, isn't it? I love that.
So
I wish that we could clone him.
I know.
Please
so
stay. Please stay.
I
No, I'm
know
kidding.
you already have plans set for after school, but if you could do anything in the whole entire world, what would your dream nursing career be?
I'm a little torn, like, at first I wanted to go into CRNA.
I knew it.
But-
Every guy.
There's a but. There's a but.
Sorry.
Obviously, at my age, I'm just like, I don't know if I want to do 3 years of school and not work.
Yeah.
My
Hello.
dynamic's a little different.
Hello.
You're working.
55.
You're
I'm in
working.
school and working.
So I've thought about going the NP route and then maybe, get some experience in the ED or ICU and then go into flight medicine.
That's so cool.
So you're not afraid to fly? We just had 2 students from Sumter that just graduated over the summer who actually are going directly into flight nursing.
That's
So you
Yeah,
have,
yeah.
do you have your EMT?
I did have my EMT. I don't
So you'll have to
anymore.
renew it for
Yeah.
that, that, right?
That's awesome, though. That's
Yeah.
so cool.
I know. I wanted to do that too until I realized I was afraid of heights.
I'm kind of an adrenaline junkie though, so
Well, I am too, but on the ground.
So have you done anything like skydiving, bungee jumping?
done
What do you do
bungee-
for
I've
adrenaline?
done
Adre-
bungee jumping.
Bungee jumping scares the snot out of me.
Um,
Now, I'll do a tandem jump of an airplane. I want to.
Okay.
That's the one thing I have never done is skydive.
Okay.
I've done
My
rappelling.
87-year-old uncle just did it.
Nice. That's what we need to do. Kick off one semester. Me and you can go skydiving and record it.
Make sure I get the invite.
Okay.
Powered up.
And going down.
But also
She's
ride
just
motor-
gonna scream the whole way down.
Probably lose
You'll
consciousness.
hear her in California. It's so funny.
Yeah, we need a GoPro.
See, I
Oh, I
also
got
ride
one.
motorcycles too.
Of course
so
you do.
Nice.
Oh, you have a motorcycle? I've always I've always wanted a motorcycle. So, how long have you been on a bike? Like, what's your longest trip?
Oh, the longest trip? Oof.
Because I
Probably
mean,
like 3 hours.
are you gonna not gang but club? They're
No.
called clubs
Gang?
now.
You just asked if Curtis was in a gang.
Yeah, well, I mean they're clubs, but I immediately want to go to
I
gang.
feel like nursing's almost a gang.
It is though.
It
I was
really
thinking this morning.
is.
I was like, it's like a fraternity or something.
We're
and then you have your
mafia.
people. Yeah, there we go.
We are mafia. We're the
Did
nursing.
you see my earrings?
No.
We won
Bill's
last
mom,
night.
yeah.
Oh,
That was
good
a
for
good game.
y'all.
That was a good game.
It was a good
Carolina
game.
won
Good game.
too. Carolina. That's
I
why
know.
you didn't ghost me. That's why you weren't talking yesterday.
Last night?
Yeah.
I told you why.
Oh, I know,
and
but
you totally
yesterday
didn't read the
dating.
text
Okay,
message, but
whatever.
that's
She
okay.
ghosts me
Irrelevant.
every weekend.
No.
They're so busy.
So, I am so excited that you came on to chat with us. I am so thankful for your light bulb moments that you gave us.
Golly, detach.
I
I'm gonna
just
keep that
I
in my
never
brain
thought about that. It's
forever.
huge. So
I
thanks for
cannot
joining
wait to
us.
hear what your, Dr. Gaffney reads what students are going to do as you
Yeah.
walk across the stage to get your pen. I can't wait to hear that for you. I mean, we kind of know what it is, but
It's going to be good.
mhm,
We're excited for you, Curtis. So
yeah.
thanks for joining us. You do have to come back and join us again a year or so from now once you're settled.
Mm-hmm.
But please do keep in touch. We're
Yes,
excited
come
for
back.
you.
Listen. Don't forget to listen.
Yeah.
Oh, definitely.
And as always, don't forget to subscribe, like, share, follow us on Pacer Nursing Power Hour.
So thanks for coming
Yes,
and
thanks, Curtis.
thanks
No,
for
thanks for having
scrubbing
me.
in.